Hi, welcome back to the channel. If you're new around here, my name is Kweku and I am a pharmacist. Today I'll be reviewing the medications Xarelto, Rivaroxaban. We'll be taking a look at the description and uses. We will take a look at its side effects and some precautions and best practices if you are taking Xarelto. As in all my videos, this is for informational purposes only and is not intended to be a substitute for medical advice from your physician. So what is Xarelto? Well, Xarelto is an anticoagulant or a blood thinner. It is used essentially to treat blood clots in the lungs or in the veins, which helps to reduce the risk of stroke or embolism in patients who have atrial fibrillation or AFib as we normally call it. And AFib is basically irregular heartbeats. And embolism is a situation where a blood clot gets stuck in the blood vessels and shuts off blood flow to that area that is served by that particular blood vessel that is blocked. Xarelto is also used for the treatment of deep vein thrombosis or pulmonary embolism, and also to reduce the risk of their recurrence. Now, thrombosis is very similar to embolism. The difference is that with thrombosis, the blood flow to the area is not completely shut off, but the flow is reduced. So deep vein thrombosis is a situation where the thrombus forms in the deep veins, usually the legs. Xarelto may also be given to patients undergoing knee or hip replacement surgery to prevent deep vein thrombosis, which may eventually lead to a pulmonary embolism. When it comes to side effects, the biggest concern, as expected, is hemorrhage or bleeding. And so for that matter, it is highly recommended that anybody taking Xarelto or any other anticoagulant for that matter should be very familiar with the potential signs of internal bleeding. These include bloody or black tarry stools, red or dark brown urine, spitting up blood, or brown material that looks like coffee grounds. If any of this is observed, it is highly recommended to seek medical attention immediately. Other forms of bleeding that has been observed with Xarelto include bleeding gums, nosebleeds, prolonged bleeding from cuts. That is when you get a cut, instead of the blood clotting right away, it takes a longer time to clot. And sometimes there may be an increased menstrual flow or vaginal bleeding. These are all things to look out for, and if they become excessive, it was definitely a good idea to seek medical help. Other reported side effects include back pain or other muscular pain. There have been reports of headache, dizziness. These are generally mild, and for the most part, they do not pose much of a problem. The biggest concerns seem to be around the issue of bleeding. However, if anything unusual is observed while taking Xarelto, it will definitely be a good idea to inform your doctor so they can evaluate and rule out anything that is potentially dangerous. Now, some precautions and some best practices. It is very important to let your doctor know of all other medications that you take, even the ones that you get over the counter. This is because some medications may increase your risk of bleeding, and when combined with Xarelto, that risk is further increased, or that risk becomes potentiated. Typical examples of medications that may cause this include anti-inflammatory medications, NSAIDs as we call them, like naproxen, ibuprofen, meloxicam, and aspirin. Some antidepressant medications, typically called SSRIs, like Zoloft, Paxil, and Prozac, have also been noted to cause a similar effect. And then even SNRIs, which are also antidepressants. So we have Prestige, Cymbalta, and Effexor. They are all medications that potentially, when combined with Xarelto, may increase your risk of bleeding. Now, it doesn't necessarily mean that you can never take any of these medications while you take Xarelto. It's usually treated on a case-by-case basis. That is why it's good to let your doctor know. They will evaluate your personal circumstances and determine whether it's appropriate for you to take any of these medications or whether an alternative should be sought for you. Concurrent use of Xarelto with grapefruit juice is also not generally recommended. This is because grapefruit juice may actually inhibit the enzyme that breaks down Xarelto. This may result in higher than expected concentrations of Xarelto. In some studies, as much as 150% what the expected concentration was. And this definitely increases the risks of bleeding as well. Another class of medications that generally should be avoided with Xarelto include some anti-seizure medications like carbamazepine and phenytoin. Now, these have the opposite effect. On the other hand, these ones actually induce the secretion of the enzymes or increase the secretion of the enzymes that break down Xarelto. This may lead to a situation where the Xarelto concentration in your body is not up to what is clinically effective to protect you from whatever you're being protected from, maybe a stroke or an embolism. So definitely let your doctor know if you take any kind of seizure medications if they're going to put you on Xarelto. Another medication which is actually available over the counter that can cause a similar scenario is St. John's wort. So absolutely let your doctor know if you plan on taking St. John's wort while you're taking your Xarelto. It is also very important not to discontinue Xarelto without your doctor's consent. Typically, even if you have to discontinue Xarelto for whatever reason, they would switch you to another anticoagulant, and there are specific protocols to follow in these instances. So if Xarelto is not working for you for whatever reason, just let your doctor know. They will find what is best for you for your particular individual circumstance. If you miss a dose, I would recommend that you get specific instructions from your doctor as to what to do, because depending on the dose you're taking depending on what condition you're being treated for, there will be specific instructions for you to follow. Better still, make sure to ask your pharmacist when you pick up the prescription so that in the event that you miss a dose, you will then not be scrambling to figure out what to do. So just plan ahead and know. But the most important thing is try not to miss a dose. That's why the risk that Xarelto has, it actually offers some advantages also compared to some other blood thinners like Coumadin. One thing, for example, there is not the need for routine anticoagulant monitoring, of course, unless in emergency situations. So it makes it a little convenient. So a high-level overview of Xarelto. I hope you found it useful. If so, please consider giving it a thumbs up and subscribing to the channel as well if you haven't already done so for more content like this. Thank you for watching, and I'll catch you on the next video.